So good morning, everybody. Thank you for coming to our our session on virtual health, which is sponsored by the Consortium of Universities for Global Health Trainee Advisory Committee. Jose, would you like to introduce us real quick?
Yes, good morning, everyone. My name is Jose. I'm from Portugal. I'm together with Jibril. We are the co-chairs of the Trainee Advisory Committee. And the people you see in the screen are the people who are part of the Trainee Advisory Committee and have been working in several committees. And one of them is the Conference Planning Committee, which is currently and today hosting this session for us. Besides this committee, we also have campus reps committee, which you can join. And then we also have the trainee advisory committee overall has a call every year for a mandate of 2 years. And this happens during the end of the summer and beginning of the fall. So if you missed the chance this year, you can apply next year. And to apply and to get involved with tech, you can also text us, email us. Your university needs to be a member, but if it's not, you can also become an individual member and enjoy reduced fees for our conference. So feel free to drop a message and work with us. Thank you.
Thank you so much, Jose, for all of those very sage words introducing our committee. So we have 3 speakers today who are going to talk about 3 different aspects of global health. And we had a rearrangement of the order of the speakers this morning. So we're actually going to start with the last speaker on the list, which is Dr. Uribe from Bolivia. And she's going to talk a little bit about the Bolivian health system and how they have decided to integrate traditional medicine and indigenous healing into the health system. It's a video that's in 2 languages. So she will speak in Spanish, and then she has a translator that talks a bit in English. So we ask for a little bit of patience if you do not understand the Spanish, because it's a really interesting story. After that, we will follow with Dr. Mugazni from Afro Health, right? And he's going to talk. How do I do that? Oops. All right, I don't have the list of what's the title of his talk. Sorry.
I think it's in the next.
Dr. Kwawo, who's going to talk about decolonizing global health. So let's get started with the video. Okay.
Algo sobre la medicina tradicional.
All right, here it is from the very beginning.
Muy buenos días a todos. Desde La Paz, Bolivia, vamos a compartir algo sobre la medicina tradicional de nuestro país.
Can everyone hear her okay?
Yes.
Yes.
Good morning, everyone. So we are going to share a bit of information on traditional medicine all the way from La Paz, Bolivia.
Primero me presento, soy la doctora Cecilia Uribe de Chávez, soy médico, pediatra, trabajo desde hace muchos años como directora médica de los programas de Child Family Health International en La Paz, Bolivia. Y tengo bastante experiencia en el campo de la relación entre la medicina tradicional y la medicina moderna en Bolivia.
So first, Dr. Uribe would like to introduce herself. Her name is Dr. Cecilia Uribe Chavez. She's a pediatrician. She is the medical director and has been working with Child Family Health International for many years. And she also has plenty of experience with the connection between traditional and modern health.
Entonces, para empezar, ¿cómo definimos la medicina tradicional? No solamente en Bolivia, sino en el mundo entero existen medicinas tradicionales. Todos los países tienen un bagaje de tratamiento de las enfermedades y mejora de la salud de los individuos, y eso es lo que se llama medicina tradicional. Pero cuando se trata de una definición académica de la medicina tradicional, decimos que son todos aquellos conocimientos y prácticas sobre salud que tienen las culturas ancestrales, es decir, las culturas antiguas que habitan en los diferentes países. Y estas culturas plantean sus conocimientos y prácticas de salud de acuerdo con su cosmovisión, de acuerdo a la manera que tiene cada una de estas culturas de ver la vida, el universo y la relación de los seres vivos.
So for starters, we're going to begin with the definition of traditional medicine. Obviously, it's not just Bolivia that has traditional medicine. This is a very well-known concept worldwide. Many different countries have their own types of traditional medicine. So the academic definition is the knowledge and practices of health of each of the ancestral cultures or ancient cultures that live in different countries. And this is based on their worldview. So the worldview is the particular way each group has of understanding and arranging the world around them.
¿Cuáles son las características de la medicina tradicional en Bolivia? Como Bolivia como país ha incorporado la medicina tradicional en el sistema de salud, entonces también ha creado una definición propia de lo que es la medicina tradicional, pero que es muy similar a la que se utiliza en otros países, ¿no? Entonces, la medicina tradicional boliviana comprende todos los conocimientos, saberes y prácticas milenarias ancestrales de los pueblos indígenas originarios y campesinos. ¿Por qué esta definición contiene estos elementos? Es porque en Bolivia tratamos de recuperar el valor de nuestros pueblos indígenas, de los pueblos que habitaban esta zona geográfica antes de la llegada de las colonias. Por eso es que nuestra definición incluye estos términos más específicos dentro del concepto de medicina tradicional.
So traditional medicine has certain characteristics. So since Bolivia included traditional medicine in its health system, we have our own definition of traditional medicine that it is quite similar to the definition that is used worldwide. So Bolivian traditional medicine are the different knowledges and practices of ancient and ancestral indigenous peoples. And the reason why we use those terms is because we as a country are trying to restore the validity of indigenous cultures that were here way before colonization.
También se aclara en el concepto que dentro de la medicina tradicional se utilizan recursos materiales y espirituales para combatir las enfermedades, porque la medicina tradicional considera que la enfermedad y la curación de la persona enferma dependen del medio ambiente y de la relación de esta persona con los otros seres vivos. Las medicinas tradicionales tienen ese enfoque, ¿no? Un enfoque holístico, un enfoque integral, donde se ve a la persona como parte del medio ambiente y parte de los otros seres vivos. Entonces, este enfoque holístico es muy propio de la medicina tradicional.
This definition also clarifies that traditional medicine uses both spiritual and tangible resources. Traditional medicine considers that illness and healing depend on the environment and the connection that the individual has with other living beings. So traditional medicine has a very holistic approach where it considers that the individual is a part of their environment or of their surroundings.
El conocimiento de la medicina tradicional se transmite de maestros a aprendices. La mayoría de las veces, al menos en la medicina tradicional de Bolivia, eran familias de médicos tradicionales. Es decir, el padre o el abuelo transmitía el conocimiento a los hijos y a los nietos. Entonces, este conocimiento era empírico, no estaba escrito, no había ni hay actualmente una escuela de medicina tradicional. Entonces, en los pueblos indígenas hay familias enteras de médicos tradicionales, ¿no? Esta era la forma normal de estudiar medicina tradicional.
So now moving on to how is traditional medicine studied. Knowledge is empirical and is transmitted from teachers to apprentices in the family environment. So most of the times there were entire families of traditional healers. Usually the parent or grandparent would transmit the knowledge to the children. So there were cases, again, in certain indigenous communities where we would find entire families made up of traditional healers. And we don't have a proper traditional medicine school. Most of the knowledge is transmitted verbally.
Sin embargo, en los últimos años, el Ministerio de Educación ha propuesto la creación de centros de educación alternativa. Estos centros de educación alternativa ofrecen formación un poco diferente a la clásica. Algunos de estos centros de educación alternativa ofrecen la formación en medicina tradicional a nivel técnico, es decir, se estudia 2 o 3 años. Aún está incipiente esta formación en medicina tradicional, ¿no? Porque no se está encontrando un equivalente académico para otorgar a los médicos tradicionales, ya que en la escuela de medicina, donde estudiamos la medicina moderna, los años de estudio son muchísimos más, ¿no? Entonces, por eso es que es un poco difícil por ahora dar un equivalente académico a los médicos tradicionales.
So currently and for the past few years, the Ministry of Education has proposed the creation of alternative education institutions, and many of them offer traditional medicine in their curriculum. So you can become a technician in traditional medicine, but you only go to their school for 2 years. But we still haven't found an academic equivalent to give to those traditional healers, because when one goes to regular med school, they have to go for many years for them to get their degree.
En estas imágenes podemos ver cómo la medicina tradicional en Bolivia se ha incorporado a la vida en las ciudades también, ¿no? En los parques, en las plazas de las ciudades, suelen hacerse lo que llamamos ferias de salud. En estas ferias de salud están presentes los médicos de la medicina moderna, dando información, promocionando los servicios del sistema de salud público que tenemos en Bolivia. Pero en los últimos años, los médicos tradicionales también forman parte de estas ferias de salud, como una forma de mostrar a la población que la medicina tradicional es parte importante del sistema de salud que tenemos en Bolivia.
So here we have a few
We stop hearing.
that live in cities. So here we have different health fairs where modern doctors or health workers provide information, education, and promotion of the different health services that our healthcare system provides. And for the past few years, traditional healers have also been participating. And this is a way to show people that traditional medicine is a very important part of our health system.
También los médicos tradicionales están organizados y desde el año pasado, desde el 2022, hacen reuniones a nivel de todo Bolivia, ¿no? Este es un afiche del primer curso de medicina tradicional boliviano. Este primer curso ha sido el año pasado, el 2022. Y la idea es que los médicos tradicionales de todas las regiones de Bolivia se puedan reunir, hablar sobre medicina tradicional, actualizarse también, revisar contenidos. Esto también me parece muy importante porque motiva a los médicos tradicionales a mejorar su práctica también, ¿no? Y también motiva a algunos otros jóvenes a conocer sobre medicina tradicional.
So traditional healers are now very organized, and since 2022, they have been conducting different types of meetings and conferences where they can different traditional healers from around the country can meet and discuss traditional medicine. They can update themselves on the different type of knowledge, and they can go through different content. So this is important because it promotes traditional healers to improve their own practices, and it also encourages young people to be more interested in traditional medicine.
Algo que es muy importante cuando hablamos de medicina tradicional son los síndromes culturales. Este término de síndromes culturales lo suelen utilizar mucho los psicólogos, ¿no? El área de salud mental, porque está demostrado que la cultura de la que provenimos define muchas de nuestras patologías, tanto físicas como más que nada mentales. En medicina tradicional es muy importante este término de síndrome cultural, porque nos ayuda a comprender cómo funciona la medicina tradicional, ya que, como hemos visto, ve mucho la relación que tiene el individuo con su entorno y con el medio ambiente y los otros seres vivos con los que está relacionado.
So a very important concept to consider when discussing traditional medicine is cultural syndrome. This is a term that is widely used by people that work in the psychology field, because it understands that where we come from determines our physical and mental pathologies. This concept is also very important, again, regarding traditional medicine, because it helps us understand how it works. Because, again, it considers that relationship between the individual and its surroundings, the environment, and the other living beings.
Entonces, en la medicina moderna, cuando hablamos de síndrome, nos referimos a un conjunto de signos y síntomas, ¿no? Que dentro de la lógica de la medicina nos llevan a un diagnóstico. Ocurre algo similar en la medicina tradicional. Hay signos y síntomas, pero que solamente pueden ser comprendidos dentro de la cultura, ¿no? Que probablemente para alguien ajeno a esa cultura no tengan el mismo sentido. Por eso es que para estudiar la medicina tradicional también tenemos que tener esa clave cultural, ese contenido simbólico de la cultura específica en la que se desarrolla esa medicina.
So in modern medicine, a syndrome is a set of signs and symptoms that can lead to a diagnosis. And it is similar in traditional medicine, but those signs and symptoms are only understood and treated among the particular culture in which they are developed. They may not make sense for an outsider. So one that is studying and trying to understand traditional medicine needs that symbolic context, that cultural key to understand the specific culture.
Entonces, esto nos muestra la importancia de las diferentes culturas, ¿no? Todos y cada uno de nosotros tiene su propia cultura, porque incluso entre personas del mismo lugar geográfico, de la misma procedencia, individualmente cada uno de nosotros tiene su propia forma de pensar y de ver la vida, el universo, nuestros propios conceptos. Entonces, es muy importante este aspecto dentro de la medicina tradicional. Y creo que es una de las riquezas de la medicina tradicional, ¿no? Porque automáticamente toma en cuenta todo este bagaje que tiene el individuo, algo que no suele hacer la medicina moderna, ¿no? La medicina moderna ve más la patología, más la enfermedad que al individuo con todo, con toda la cultura, las creencias, sus tradiciones, todo lo que esa persona trae consigo.
So all of this shows us the importance of different cultures. Each and every one of us has their own culture, even if we come from the same background, if we live in the same place. Individually, we each have our own way of thinking, our own way of understanding the world, our own concepts. So this is a very important aspect in traditional medicine, and it automatically takes into account all of that baggage that each individual has, unlike modern medicine, which doesn't really take into account all of those knowledges and practices that each person has.
Esto es algo que los médicos tenemos que aprender de la medicina tradicional, ¿no? A ver al individuo como parte de una cultura, de una tradición, a ver al individuo como alguien que tiene sus propios hábitos, sus propios códigos y algunos rituales con los que lleva su vida, que casi siempre provienen de enseñanzas de padres, de abuelos o incluso de personas más atrás, ¿no? Este es un gran aporte que tiene la medicina tradicional y es una de las cosas que más me atrae de la medicina tradicional, ¿no? El ver al individuo con todo lo que trae, ¿no? Y no solamente esperando una indicación del médico, sino también aportando todas sus prácticas para mejorar su salud.
So this is something that health workers need to learn from traditional medicine, that an individual is a part of a culture. It has its own traditions, their own habits, their own rituals that may come from their ancestors. So this is a major input that traditional medicine brings to the table, to understand the complexity of each patient, each individual, so that you don't only diagnose and provide treatment for them based on only academic knowledge, but also taking into account all of that baggage that person has.
En Bolivia, parte de la medicina tradicional son los rituales. Hay muchos rituales, pero la mayoría de ellos tienen involucrado al fuego, ¿no? El fuego es uno de los elementos más importantes dentro de la medicina tradicional de Bolivia. Entonces, cuando vamos a hacer alguna actividad, cuando vamos a emprender algo, un nuevo trabajo, una nueva casa, una nueva actividad, entonces hay que hacer un ritual para que la Pachamama nos ayude en estas circunstancias. La Pachamama, que es la Madre Tierra, también es muy importante dentro de la cultura boliviana. Aquí les pongo algunas imágenes de lo que llamamos mesas, que son ofrendas ya preparadas que se queman en el fuego y que están destinadas a que la Pachamama nos ayude en lo que estamos por emprender.
So rituals are a part of traditional medicine. Many include fire, since this is one of the most important elements in Bolivian traditional medicine. So when one is going to undertake different activities, they're going to start a new job or school, you do offerings for Pachamama or Mother Earth. So here we have a few pictures of those offerings, and they are formed based on the different things that one wants to ask or thank Pachamama for.
¿Cómo pensamos que la medicina tradicional ha ido desarrollándose en Bolivia? Uno de los pueblos más antiguos era el pueblo de los Callahuayas. Este pueblo trabajaba mucho con hierbas y con diferentes rituales para mejorar la salud de las personas. A partir de ahí se ha ido extendiendo la medicina tradicional en Bolivia, adquiriendo diferentes matices de acuerdo a las regiones geográficas y a los pueblos indígenas que habitan el territorio. Pero ha quedado el nombre de Callahuaya como el del médico tradicional más antiguo dentro de lo que conocemos en esta región.
So traditional medicine has developed in a very interesting way throughout time here in our country. There's a very ancient culture called Callahuayas, and they used different rituals and medicinal herbs to improve health of their population. So traditional medicine has developed from that, including different elements that were used in the distinct areas of our country, but the name or the term has stuck to refer to traditional healers.
Uno de estos médicos callahuayas, es decir, procedía del pueblo callahuaya, pero también estudió medicina moderna en la universidad. En los años 80, más específicamente el año 1987, se creó el Instituto Boliviano de Medicina Tradicional Callahuaya. ¿Y cuál es la importancia de esto? De que a partir de este momento, la medicina tradicional pasó a ser reconocida dentro del sistema de salud de aquel entonces en Bolivia. Porque hasta antes de esto, la medicina tradicional era como mal vista por la sociedad en general, ¿no? Incluso se penalizaba el uso de la medicina tradicional. Se trataba de eliminar la medicina tradicional. Ese es el gran aporte de este Instituto de Medicina Tradicional Callahuaya, ¿no? Que ha logrado que el gobierno boliviano de ese entonces reconozca la práctica de la medicina tradicional y la incluya dentro del sistema de salud.
So in the year 1987, the Bolivian Callahuaya Traditional Medicine Institute was created, and it allowed for the Bolivian government to recognize the validity of traditional medicine, because before that, traditional medicine was frowned upon, and even some of its practice was being sanctioned. So with the creation of this institute, the government recognized its practice and its inclusion into our health system.
Y este mismo Instituto de Medicina Tradicional hizo todas las gestiones para que la UNESCO declare a la cosmovisión callahuaya como obra maestra del patrimonio oral e intangible de la humanidad. Esto ocurrió el año 2003. Entonces, hace 20 años que la medicina tradicional callahuaya está protegida por la UNESCO, ¿no? Y todo esto lo ha logrado este médico callahuaya, Walter Álvarez Quispe, que ha sido el promotor de que la medicina tradicional sea reconocida en Bolivia y sea protegida, porque al nombrarse como patrimonio oral e intangible de la humanidad, no puede ser destruido. Tiene que ser cuidado, tiene que ser protegido como un mandato de la UNESCO.
This institute also arranged for UNESCO to declare Callahuaya medicine as a masterpiece of oral and intangible heritage of humanity in 2003. And this was all thanks to a surgeon, Dr. Walter Álvarez Quispe, who was also a Callahuaya doctor. So thanks to this, Callahuaya traditional medicine is recognized and protected.
Entonces, vemos que en los años 80, a fines de los años 80, ya se logró el reconocimiento de la medicina tradicional. Sin embargo, en el año 2013, recién en este año 2013, se creó una ley para la medicina tradicional boliviana, ¿no? ¿Cuál era el objetivo de esta ley? Regular el ejercicio, la práctica y la articulación de la medicina tradicional en el sistema de salud. A través de los años, la medicina tradicional ha crecido mucho y por eso es que se ha visto necesario tener una ley para regular el ejercicio de la medicina tradicional dentro del sistema de salud de Bolivia.
So we can see that back in the 80s, traditional medicine had its validity recognized by our government. And in 2013, it created a law to regulate its practice. So throughout the years, traditional medicine grew and expanded a lot. So it was a necessity to regulate its practice, and that's why this law was created.
Los médicos tradicionales más antiguos, ¿no? Los callahuayas, en un principio no estaban muy de acuerdo con que haya una ley que regule el ejercicio de la medicina tradicional. Sin embargo, como les decía, la medicina tradicional se ha extendido mucho en Bolivia y ha dejado de ser solamente de los callahuayas. Y por eso también se han visto casos de mal uso de la medicina tradicional. Por eso es que ha sido muy necesario crear una ley que regule esta práctica, ¿sí? De tal forma que también los médicos tradicionales están protegidos por la ley, pero los usuarios de la medicina tradicional también están protegidos contra cualquier mal uso que pueda haber de este tipo de medicina.
So at first, traditional Kayawaya healers did not really agree with this law. But again, like Dr. Uribe mentioned, traditional medicine expanded quite a lot. It wasn't just being used by Kayawaya people, and it led to its misuse. So that's why it was necessary for this law to be implemented, so that traditional healers would be protected by law, but also patients could also have some sort of protection against any form of malpractice.
A partir de esta ley, tenemos un registro de médicos tradicionales en Bolivia. Este registro se hace en el Ministerio de Salud. Entonces, para poder ejercer la medicina tradicional, el médico tradicional debe estar registrado y tener una licencia para poder ejercer. Actualmente hay 5.000 médicos tradicionales registrados. Y también tenemos 4 especialidades reconocidas dentro de la medicina tradicional.
So with this law, we now have a registry of traditional doctors of Bolivia. So for a traditional healer to practice, they need to be registered in the Ministry of Health, and they need a license to practice medicine. So now we have 5,000 traditional healers in the 4 different specialties that are recognized.
Como los médicos tradicionales están incorporados al sistema de salud, en algunos lugares, en las áreas rurales, el médico tradicional trabaja en el mismo centro de salud con el médico de la medicina moderna, ¿no? Y los pacientes pueden elegir con cuál de los dos atenderse. Se hace un tipo de atención que se llama intercultural, donde ambos tipos de medicina, la tradicional y la moderna, ayudan a mejorar la salud del paciente.
Since traditional healers are now included in our health system, in some rural communities, traditional doctors work alongside modern doctors in certain health services. So the patient is able to choose which doctor they want to see. And this type of service is what we call intercultural health, where we recognize that both types of medicine can help the patient.
Las 4 especialidades que reconoce la ley en Bolivia son las parteras, los amautas, los médicos tradicionales y los naturistas tradicionales. Entonces, todos los médicos tradicionales tienen que registrarse en alguna de estas 4 especialidades, ¿no? Esto con la idea de que una persona que sea médico tradicional no haga todas las actividades, ¿no? Sino que enfoque su práctica en alguna de estas especialidades.
So the four recognized specialties are midwives, amautas, traditional doctors, and traditional naturalists. So a traditional healer has to be registered under one of those specialties so that they can focus their practice on one of those 4.
Entonces, las parteras tradicionales son las mujeres, en su mayoría mujeres, hay algunos hombres, pero en su mayoría son mujeres que hacen el seguimiento del embarazo y asisten durante el parto. Estas mujeres trabajan en las comunidades indígenas y muchas veces también ellas están dentro de los centros de salud de la medicina moderna y trabajan en coordinación con el médico para que las mujeres que están dando a luz se sientan más, con más confianza, ¿no? Más tranquilas al tener a su partera ahí durante el trabajo de parto.
So first we have traditional midwives. These are mostly women that follow up on a woman's pregnancy and they also assist her during labor. Oftentimes they also work in modern medicine clinics, and this helps gain the trust and the comfort of the patient.
Aquí tenemos algunas imágenes, por ejemplo, en esta de arriba vemos una partera tradicional atendiendo a una mujer en la casa de la mujer, ¿no? La mayoría de las parteras tradicionales antiguas prefieren hacer las atenciones en la casa. Sin embargo, en la imagen de abajo vemos a una partera tradicional que está incorporada al sistema público de salud y entonces trabaja en un servicio de salud de la medicina moderna.
So here we have a few pictures. On the top left, we can see a traditional midwife assisting a woman at her home. Many of those more traditional women prefer to assist labor at the patient's home. But we also have other instances as shown in the other picture of midwives that work within the more modern health system, so they work at clinics.
La segunda especialidad son los guías espirituales, que también se llaman sabios andinos o amautas. Ellos son los encargados de los temas espirituales, emocionales, ¿no? Y son también los encargados de realizar los rituales, las ofrendas a la Pachamama. Entonces, son una de las especialidades más demandadas por la población en general, ¿no? Porque como hemos visto, cuando queremos emprender algo, un negocio, o cuando queremos tener una casa nueva, cualquier cosa que necesitemos pedirle o agradecerle a la Pachamama, debemos recurrir a los servicios de un guía espiritual o a una amauta para que nos ayude con ese ritual de gratitud o de pedir algo a la Pachamama.
Next, we have spiritual guides, also known as Andean sages or amautas. So they have knowledge on spiritual matters, and they are also the ones in charge of making offerings to Mother Earth or Pachamama. So when one wants to build a new home or they are undertaking a new enterprise, they turn to amautas for them to perform different rituals. Again, if you want to ask something from Pachamama, or if you just want to say thanks and be grateful to her.
Al ser una de las especialidades con mayor demanda, existen muchos amautas, sobre todo en la ciudad del Alto. Entonces, estas son imágenes de algunas calles en el Alto, donde vemos que las oficinas, los puestos de los amautas están uno al lado del otro, muchísimos, ¿no? Aquí abajo igual, ¿no? En otra zona del Alto igual están los amautas en gran cantidad, ¿no? Y ellos están ahí todos los días y pues, las personas ya conocen y solamente tienes que ir y solicitar los servicios de un amauta.
So this specialty is on very high demand. So there are some streets, especially in the city of El Alto, where you find rows and rows of their stands. So they work 7 days a week. So if you need their services, you can just go to those streets in El Alto to ask for them to perform a certain ritual.
La otra especialidad es el médico tradicional, aunque a todos les decimos médicos tradicionales, pero podemos ver que según la ley, el médico tradicional es el que tiene los conocimientos sobre la medicina natural. Es el que se ocupa más de las enfermedades físicas, ¿no? Y tiene el conocimiento de estos síndromes culturales y por lo tanto él puede hacer una especie de diagnóstico del padecimiento de una persona.
So next we have traditional doctors. So they have extensive knowledge about natural medicine, and they are trained to treat all physical illnesses that a person may have. They also have ample knowledge on different cultural syndromes, so they are able to diagnose patients.
Algunos de estos médicos tradicionales también se especializan en algo en particular. Una de las especialidades más frecuentes son los hueseros, que son los médicos tradicionales que se dedican a tratar todo lo que tenga que ver con huesos, articulaciones. Entonces, las personas que sufren esguinces, incluso fracturas, pueden hacerse tratar con un huesero.
Some of these traditional doctors have other specialties. For example, some are hueseros or bone setters. So they are specialized on everything that is related to bones and joints. So they can treat a sprained bone or even fractures.
Y la última especialidad son los naturistas tradicionales. Los naturistas conocen las propiedades de las hierbas. Entonces es como una relación entre el médico tradicional, que es el que puede hacer como el diagnóstico del problema de salud de la persona, y el naturista tradicional, que conoce cuáles son las hierbas apropiadas para la dolencia del paciente, ¿no? Entonces, también es una especialidad muy común. El naturista tradicional elige las hierbas y las prepara de acuerdo a la necesidad.
So finally, we have traditional naturists. They know the properties of medicinal plants with which they can make concoctions. So there is a connection, a relationship between traditional doctors that diagnose what the patient has and naturists that knows the proper herbs that can be used to treat that illness.
Los naturistas tradicionales son los que están más presentes en las ferias de salud de las que les hablaba, ¿no? Ellos promueven mucho el uso de hierbas para tratar las diferentes dolencias.
Naturists are often found participating in health fairs, so they are the ones that promote the use of medicinal herbs to treat different ailments.
Durante la época del COVID, los médicos tradicionales han estado muy presentes para ayudar. Ha sido una época en la que la medicina moderna y la medicina tradicional han podido trabajar conjuntamente, ¿no? Los pacientes que tenían síntomas leves de COVID eran tratados con medicina tradicional. Y los pacientes que ya necesitaban terapia intensiva, otro tipo de medicamentos, oxígeno, entonces eran tratados por la medicina moderna. Entonces, durante la época del COVID, se ha visto que se puede trabajar en forma conjunta la medicina tradicional y la medicina moderna y que se pueden obtener muy buenos resultados en este trabajo conjunto.
During COVID, traditional healers played a very important role. Traditional and modern medicine had to work in tandem. So mild symptoms were treated with traditional medicine, and more severe cases of COVID were treated with modern medicine. So this showed us all that both types of medicine can work in a joint way.
Y esperamos que ese sea el futuro de la medicina en Bolivia, ¿no? Que poco a poco se logre el trabajo conjunto, el mutuo respeto entre ambos tipos de medicina, ¿no? Porque cuando vemos el sistema de salud de Bolivia, que es universal, es gratuito para todos, y sabemos que la medicina tradicional forma parte de este sistema de salud, entonces también tenemos que comprender que el futuro de nuestro sistema de salud es el trabajo conjunto, ¿no? No vamos a poder dividir el trabajo, sino más bien tenemos que trabajar todos para que sea una práctica común el utilizar la medicina tradicional y la medicina moderna en beneficio de los pacientes.
So the hope is that we reach joint work, since now our current system provides free universal healthcare for everyone. Logically, the future of this system is to work that both types of medicine work together, that we use both of them to benefit the patient.
Bueno, eso es todo lo que tenía para compartir sobre la medicina tradicional dentro del sistema de salud de Bolivia. Muchísimas gracias.
So that concludes Dr. Uribe's lecture on traditional medicine here in Bolivia. Thank you very much.
Okay. In following, I have a short video that talks a little bit about the Kayawaya culture. It has some subtitles in English, and it's only about 8 minutes long.
Son los hijos del padre Akamani y de su nieve eterna. Son los hijos de la madre tierra, la Pachamama. Son los Kayawayas, de los Andes orientales de Bolivia. Son los portadores de un conocimiento cuyo origen se pierde en el tiempo. Son los Kayawayas, los que cargan conocimiento y los que llevan sabiduría. Conocen los arcanos de la naturaleza y han descifrado su magia. Viven en Chari, Chajaya, Canlaya, Huatahuata, Inca, Curva, Niocorín, Caata, todas comunidades de valles situadas entre los Andes, la cadena montañosa más grande del mundo, y el Amazonas, la selva más inmensa y más rica en biodiversidad del planeta. Viven próximos al pueblo de Charazani, la capital provincial. La zona alberga transiciones geográficas excepcionales. Es el centro ritual más importante y tal vez un eje cósmico. Viven en un territorio donde confluyen 5 pisos ecológicos diferentes, desde la puna árida, los bosques y yungas del trópico, hasta las tierras bajas. Han hecho de esta naturaleza singular y diversa su laboratorio donde aprendieron los secretos para curar el cuerpo y también el alma. Estudiaron las plantas, los animales y los minerales de su entorno. Descubrieron su magia oculta, sus facultades y sus propiedades extraordinarias, y a la vez sintetizaron los conocimientos de los pueblos de las tierras bajas. Se convirtieron en expertos botánicos y herboristas, extrayendo de las plantas su poder y su medicina. Fundaron su propia farmacología y taxonomía. Crearon ceremonias mágico-curativas y muchos de sus saberes ya han sido incorporados en la medicina occidental. Son los Kayawayas, médicos rituales del mundo andino, cuyos conocimientos y poderes transmitidos de generación en generación han ganado fama y respeto a lo largo de la historia en todo el continente americano y más allá aún. Muchas veces incomprendidos y menospreciados, pero su bagaje de conocimientos sigue intacto y tal vez en él se encuentre la cura de muchos de los nuevos males que acosan a la humanidad. Formaron un señorío propio en el siglo XII de nuestra era, luego del declive de la cultura tiwanaku. Fueron respetados por los incas y sirvieron como intermediarios con las tribus de la selva amazónica. Se convirtieron en los médicos del gran estado incaico. Su prestigio era tal que eran los encargados de portarlos en sus literas. En la colonia también tuvieron un lugar de privilegio. Los españoles los respetaron por sus saberes y los utilizaron por sus conocimientos de médicos curanderos. Durante el siglo XIX, inician sus peregrinajes terapéuticos, asimilan otros conocimientos y fundan su fama como médicos viajeros, doctores itinerantes que enlazan con su saber y sus hierbas a todos los confines del continente. Son registrados sus pasos y sus curas en Buenos Aires y Montevideo, por el sur, en Brasil por el este, en Perú por el oeste y el Pacífico, donde dan vida a los llamados curanderos chamanes. llegaron por el norte hasta Panamá en la época de la construcción del canal, donde controlan un brote palúdico en base a quinina. Fueron invitados por los académicos de la Sociedad Geográfica Francesa a mostrar sus virtudes en la Exposición Universal de París de 1889. Durante la Guerra del Chaco, conflagración entre Bolivia y Paraguay, en la cuarta década del siglo XX, fueron los médicos de campaña de la masiva tropa indígena que combatió. Son los callahuayas. Son portadores de una cultura extraordinaria. En sus ceremonias y ritos hablan el idioma puquina, que los estudiosos suponen fue la lengua de los antiguos tiahuanacotas. Ellos lo denominan Machaj Huyay. El puquina, el idioma más antiguo de la actual Bolivia, está dotado de poderes curativos, como también la música que ellos ejecutan y que denominan cantus. Para los callahuayas, todo cura, todo sana, todo restablece el equilibrio natural en el cuerpo y en el espíritu, incluso los sonidos y las palabras. Invocan a la tierra, a las deidades de las montañas y a sus ancestros. Así como los hombres son los encargados de preservar toda esta sabiduría, de padre a hijo, sus mujeres son las portadoras del conocimiento del arte textil, especializado por siglos. Los textiles son una expresión simbólica refinada de su identidad étnica y social. Representan su cosmovisión y también el increíble conocimiento de su entorno, de donde extraen los colores que los embellecen. Hoy, toda esta riqueza cultural, todo este saber, todo este milenario patrimonio único está en peligro. Corre el riesgo de perderse para siempre. Las presiones y alteraciones a su entorno cultural y la vulnerabilidad emergente de la imposición de una cultura global están poniendo a prueba su capacidad de resistencia. Muchos jóvenes migran a las ciudades, tentados por la modernidad, y se aculturan, perdiendo sus tradiciones y costumbres. Las sectas religiosas los acusan de brujos y de practicar la hechicería, y a veces los callahuayas son hostigados y marginados. El idioma y la música sobreviven en pequeños bolsones de practicantes presionados por culturas más poderosas. Son los callahuayas, grandes mediadores culturales de todas las clases sociales. Son los callahuayas, los hijos de la Camani y la Pachamama. El mundo todavía tiene mucho que aprender de ellos. Si hemos contaminado el cuerpo con nuevos y demoledores virus, si hemos extraviado el alma, si andamos como perdidos en un ecosistema terrestre agredido por nosotros mismos y nuestra manera de vivir, ellos pueden tener muchas de las respuestas que precisamos para volver a encontrar el camino. Un camino de respeto y tolerancia entre culturas. Un camino de intercambio de saberes y poderes. Un camino de equilibrio natural y paz entre los hombres. Un camino que empieza en los Andes de Bolivia, donde debemos alentarlos y preservarlos. Son tradición viva. Son sabiduría que sana. Son los callahuayas.
All right. Well, thank you everyone for listening and being present. Unfortunately, Dr. Uribe couldn't be here in person due to a last-minute conflict. I personally have lived, here I can put my video on, in Bolivia for over 7 years, and I know some things about their health system. I also have some close personal contacts amongst the traditional healers, some Kayawaya and Amauta. We have about 10 minutes now for discussion and questions, and I will do my best to help answer these questions. However, if you would like some further information, we can forward more questions to Dr. Uribe and start a conversation by email, and I'm happy to help translate for anybody. I'll put her email in the chat. You can also put any questions in the chat. And I'll put up her screen. So are there any questions?
Yeah, there's questions, Ricky, can I ask here?
Yes, absolutely.
I'm Jibril here. I would like to ask, and this question is to Cecilia. Do they use this traditional-based treatment approach to treat clinical diagnosed diseases, such as like mental illness or any other medical conditions? And if they use, how they use it? And if they use it, do they work with mainstream medicine or they are separate entity?
You're talking about in Bolivia or
In Bolivia, in Bolivia.
So there we go. I just put Dr. Uribe's email in the chat, or I'm going to put my name as well. I can help translate. There we go. It's a little bit of both. So they do have psychologists. We're talking about mental health issues. They do have psychologists and psychologists. There are people who don't believe in the traditional medicine, and they never go to see a traditional healer. However, there's also a large population, it's over 50% of indigenous people in Bolivia. So they have a very large, what we here in the States call a minority population. And so there's also a large pressure for trying to incorporate those people into a medical healthcare system. And one of the big advantages is, of course, that component of traditional health in that country. And for those types of treatments with mental health and some physical health as well, especially the indigenous people, I'll often go or choose to go to the traditional healer first. So that's a little bit of both. Did that answer your question at all?
Yes, you answered it, but I just wanted if they collaborate. In our context, for example, we work together, the traditional healers and the clinicians. In the Bolivia context, do they sit down together and share expertise?
Yes and no. In certain rural communities, you will have traditional healers present as well as modern healers. And for example, during birth, sometimes they'll work together. There are some people like Dr. Uribe who've learned to appreciate both sides of the medicine. And there's modern medicine and modern hospitals that don't appreciate both sides of the medicine. What country are you from?
I'm Jibril.
Oh, you're Jibril. Okay.
Yes. Nice to meet you.
What country are you from again, Jibril?
I come from Somaliland, in East Africa. That's good.
Perfect. And so, yeah, those type of questions can also be articulated too, and we can send them directly to Dr. Uribe for more conversation as well.
Because this story from Bolivia is really interesting.
Mm-hmm. Thank you.
Just to note, Ricky, there's a couple of questions in the chats already.
Okay.
Jose wants to ask you a question. You may allow Jose maybe.
I'm reading the questions in the chat first. Will the recording of this presentation be available to the attendees later? I'd like to share it with my students and faculty. I can send the presentation out, or perhaps, I don't know if Dalal is there and she knows more about how the recording of this presentation of the entire session, if that's going to be available to all attendees.
Yes, the recording will be made available on the CUGH website for anybody who wants to look over afterwards.
Okay. And so Mrs. White, if for some reason that's not enough, I do have the video, and I can find a way to share that. I put my email in the chat as well, so I would invite you to write that down. So Pascal Felix wrote, is there a good understanding of psychoactive herbs preparations in Bolivian traditional medicine to treat mental health needs? So I have a close personal friend, Dr. Aurelio Ortiz, who's a Kayawaya healer, and he operates the Wachuma, which is a psychoactive cactus plant. I do know that they do not use the ayahuasca, which is well known as well, which is also psychoactive. That's a bit more common to use up in Peru. But those types of psychoactive herbs and preparations are manipulated by traditional healers. And I've had some long conversations with them as well. They feel that those herbs can be very useful when they are managed by a traditional healer with a good connection to their spiritual guides, or with a good understanding of how to use those herbs. Because if you do not, then you can actually cause more damage than good by using them incorrectly. So I don't know if that helps answer your question, Pascal. But there's definitely a respect that there's a danger associated to the herbs when they're not used incorrectly, and you do need to have somebody who knows how to use them in order to get benefit out of it. Amy Chris has written that the presentation was quite enlightening and educative. Can we get the English version of the write-up? To chrisamy25@gmail.com. So I do not have an English write-up of the presentation. However, the recording will be available. And again, my email is up there, and we can make sure that you have a copy of the entire presentation as well, the audio. Any other questions? Someone said there's a hand up.
It was Josie. Or Jose, sorry.
Jose, you have a question? All right, that's it for oh, there we go. Chat.
One last question, Ricky. Can you hear me?
Yes, I can hear you.
Perfect. When it comes to adverse events in Bolivia, how often do you see that as a function of traditional medicine? Meaning, they go to the traditional practitioner beforehand, something goes wrong, and then there's a follow-up in a clinical setting. How often do you see that?
I do not know statistics. I have heard stories of the opposite happening, where people go to modern medicine, it's not resolving the problem, or they're having adverse effects and they go to the traditional healer to try to find a solution. that people go to the traditional healer and then go to the modern medicine. I am certain it also occurs. I do not know the statistics, and I haven't heard the story yet. As far as from use of the psychoactive drugs, again, I haven't heard of that either. But I have heard of traditional healers having to heal improper use of psychoactive drugs with rituals. And those rituals don't always contain more psychoactive drugs. They're often associated with a lot more meditation and talk and other types of rituals as well. I don't know if that answers your question any.
It does.
And I'm happy to forward that question to Dr. Uribe if you would like.
Please, thank you. I'll follow up with you.
Yes, no problem. I do say that Jose has his hand up. Jose? Oh, here we go. Okay. If there are no further questions, I was curious, Mr. Jibril had mentioned that in his country, they also have some traditional health practitioners that work helping to expand medical attention to the communities. What other countries are people from where they're also aware of traditional health practices in their area? And what role do they play in medicine? How are they viewed?
Can I ask a question, Ricky, please?
Hi, Samuel. I see that your hand's up. Go ahead.
Right. It's as it relates to the psychoactive effect of this herb. Now, I want to ask something. Do they factor in the species? The species. Okay, for example, right? We all know about the marijuana. It have different species. So in some countries, in the Caribbean, the species in the Caribbean may be more potent than the species in probably in Africa or Europe. So when preparing when making the solution or the formula, do they factor in the species as to get the right quantity and the right concentration to get the desired benefits? Because different species of the same plant actually have different degree of potency. So do they factor in the species of these plants?
What I do know from the treatments that Dr. Ortiz has done is that he knows his local wachuma. The marijuana is not used medicinally that I know of at all in his practice, but the wachuma, which is the cactus, is. And I'm certain there's different types of wachuma, but he knows the wachuma that he uses locally. He knows how to prepare it appropriately. And if he were to go to a different location, you're right, it may be more or less potent. He is aware of differences in the plants according to where they grow. And he's also aware of if it being more potent in one area versus in other area. And that's not necessarily just psychoactive plants. It could be other types of medicinal plants like your chamomile, wida, other type of plants used for the common cold or for stomach pain, digestive issues like el boldo. So he is aware of the fact that plants grown in different locations have different properties. Very much so, yes.
Yeah, thank you for your response. And of course, I only use marijuana as an example. I never said that marijuana is part of the, I only use it as an example. Thank you for your response.
I did see that someone answered to my question here that in Haiti, there's also some similar access to traditional medicine, but it's not integrated into the medical field very much. I'm going to pass this on to the next speaker so we don't run out of time. Does anybody else want to share another country where they're aware of traditional medicine and whether or not it plays any part of the medical system or healthcare? All right.
Hello. Hello.
Yes.
Okay, so this is Christy.
Mm-hmm.
I just want to share for Nigeria.
Mm-hmm.
We do have a very complex and extensive traditional healthcare system. It spans largely from, we have a huge number of practitioners, and these include the people we call the traditional birth attendants, who are like midwives. We have the bone setters. We have people who give herbs. I think they're just called traditional medicine practitioners. So there's a whole range of them. However, they're largely unregulated health, at the federal level to kind of regulate their practice. But it's not been very successful because a huge number of people actually patronize them, and it has not been integrated into the healthcare system. But it is largely patronized by people from all walks of life, even the educated people. So it's actually acceptable, and it works, even though, well, for some people, you see them come to the hospital and there has been 1 or 2 cases of mismanagement of cases, but largely they are patronized and they're actually working. So that's our experience.
Well, thank you very much for sharing that. All right, I think we are, whoops, I should have shared that again. It's time for our next talk. Oh, I'm all confused how to do this again. Screen share, there we go. So I believe the next person who's going to be presenting, how do I do this? Is Dr. Mugazni. Are you there?
Hello, yes, I'm here.
All right. Would you like to go next?
Yes, sure. I'd like to go next.
All right, so Dr. Mugazni is our next talker. Present to us on empowering global health innovators, strengthening research skills and impact. Can you screen share so you can share your presentation, or do we have to do that?
I would appreciate if you can do it from your end.
Omoloma, can you do that?
Would you like me to share the slides?
Yes, please, Sarika, if you can do that.
Okay.
And Dr. Mugazni, maybe you can introduce yourself real quick.
Okay, all right. Thank you so much for the invitation to discuss a topic that is very dear to my heart. I'm David Jody Muganzi. I'm a doctor in Uganda and based in Kampala. I'm a leader at AfriHealth, where I lead the student community and also started patient-centered care movement Africa, which is a community of practice for health professionals on the continent to drive up advocacy and practice of patient-centered care. And I am into health innovation currently. My projects are around leveraging data science to improve diagnosis, and our lab is focusing on malaria diagnosis. So with that said, I would like to start the conversation on global health innovation, and we're going to be focusing on strengthening research skills and impact. I am going to share a few stories from my experience, and I hope this will be interactive too. All right. Has the screen been shared?
Yes, I have it up. Let me know when to change slides, please.
Okay. All right. That's good. So we can go to the next one. So
Can everyone see his slides? Because I can't see them yet.
I think Omolola to stop sharing. She has to stop sharing so that there'll be.
Give me one moment. Let me check. Seems my computer's taking a while to load up the slide for the share. One moment, please.
It's good. It's good now.
Thank you.
Yeah, I can see it. Continue, please, Dr. McGasney.
all right. Thank you so much. So I wanted to lay ground for the discussion by us first agreeing on what innovation is, and I would like to just hear from the people on the call what innovation is to you in your field or in the current work that you do right now. Just in a minute, what comes to your mind when you hear the word innovation? Yeah. Okay. All right. So
New methods, new ideas, doing things with and of course getting the desired set goals and objectives using new methods.
Okay, I'm seeing new methods. There is a novelty. There's breakthrough, and I think that is what. Yeah, that is really it. So when we talk about innovation, most of the times it's the bright bulb that comes in people's minds. Technology, different ways of doing things, which is really right. It is really a process of bringing up new ideas, methods, products or services or solutions. But it doesn't stop there. It continues to ensuring that these new ideas, these new products have positive impact and value. And when we have that positive impact and the value, that's when we say that the cycle of innovation has actually been completed. It involves increasing efficiency of the old processes or the effectiveness, and address using new methods or existing methods to meet unmet needs. They could be from a different location to your location, or you could be exporting them. And it is, while sometimes it is limited to technological advancements, innovation actually encompasses more than this. It can be around organizational practices. It can be around business models. It can be around how ward rounds are conducted in a hospital, or how patients' records are kept. And the number one thing that is central to all these things is that there has to be change, a positive kind of change, and it requires a lot of work. It requires time, and it requires a dedication to learn a certain set of skills for the ideas and the new methods to go through the process of reaching to the point where they become impactful. And let's go to the next slide. I'm going to just share a few stories about some of the innovative things that we live with every day, and how that relates to global health innovation. Next slide, please. One of the oldest things that humankind has been able to innovate or come up with is the ability to tame fire. Right now, it seems so trivial, but in the Stone Age, this was the life-changing innovation that came about. And it is not documented how this was done, but my best guess is it was out of trial and error that people found a way of taming fire. And then we got to an advancement where people were able to actually move away from a lifestyle of hunting and gathering for food to a point where they could live in one place and put seeds in the ground and wait for them to germinate and harvest them and then eat. And this was one of the biggest, this caused one of the biggest changes in the history of humankind, in that people started living longer, people started being healthier, people started building cities. This is when people started building large communities, and the other innovations that have come up in our societies started mainly because people were able to stay in one place and grow food. And then the other that is very fascinating for me is the printing press. Before the printing press, putting together information on paper was quite tedious and took a long time. And books and information and knowledge was for the privileged few. But with the printing press, we saw that there's a lot of information that was able to be put down into books and paper. And this promoted things like science, because we know science is around getting knowledge and using that knowledge to investigate the world further. And this too was a great innovation. And then specifically, I want to talk about the microscope. The microscope started out as it was a simple innovation. It was two lenses put together in the same line, and they were used to look into the small world. Used to look into, they were calling it the small world then. The person that invented it was calling it the small world, but it was not sophisticated, and that's what I want to bring out here. It was not about putting together new machinery or a lot of sophisticated software like we do right now. It was about getting the already discovered lenses and putting them together in unison, and then looking at what happens to that. And with this, we saw the world open up in so many ways, that people started seeing cells, people started seeing bacteria and the other things. And with that, we had antibiotics come up. And this is one of the groundbreaking innovations of our times, in that there are millions of deaths that have been prevented because there are antibiotics. And these two came out of observation. It was Alexander Fleming. He noticed something different from what he was seeing every day in his lab. And then comes in one of the greatest innovation of our time right now, the cell phone. For a while, there was communication around the world, and then a BlackBerry came in with something that you can hold in your hand and communicate, and BlackBerry was the thing. And then Apple came in with this small handheld device without buttons, and at that time it looked ridiculous, but right now we can barely live without it. And just with the cell phone itself, we have seen a lot of innovations come up. The idea of having mobile applications itself right now looks trivial, but it wasn't there earlier. The idea of the internet and different applications like Zoom that we're using right now, these are all, with each of these things, there is something that is unique about them, but there's also something that is common about all of them, in that in all of them, there were individuals, yeah, that dedicated their life, their time, and mastered certain skills and got to change the way things were. They either got to solve a problem or capitalize on an opportunity. Obviously, these are just few of the innovations, but I just wanted to jog your mind into what innovation can be like. So I'm going to share about the innovation process. It is not linear. We can move on to the next slide, please. So the innovation process is not linear. It is not, there is not one process that one would say, this is what innovators do to come up with new things, or this is the best way to go about an innovation. But there are a little bit of, there are certain elements that make up the framework of this innovation process. There are certain things that innovators across different cultures, across different ages have done and can still be done in our age, where some people think everything has been discovered, yet we still have more problems in the world, so there's still so much innovation to do. And next slide, please. And with the different stages that can happen through the innovation process and the different things that I'm going to talk about, there's one disclaimer I want to make, is that there is nothing linear. The start of every process of innovation is like these small lines. It's really chaotic. At first, you may think you've gotten it, and then in the middle, it gets so chaotic. What you thought at first works actually doesn't work, and you have to be at constant learning and constant unlearning. And then, but however, with time, if you go through past the stage of maximum chaos, the final products or the ideas or the services or the processes to make impact and improve the way things are done comes up eventually. Next slide, please. So I've tried to structure this so that we have something to discuss. So I'm looking at the innovation process. There's one thing that is so key, and that is recognition. Recognition of a problem or an opportunity. It is from my background, this is one of the things that I think innovators do wrong the most, because most times people recognize a call for a grant application or a call for an innovation, and that is when they start their innovation process. The ideal innovation process has to start with recognizing a problem or an opportunity in the real world. And after, I'm going to go deeper into each of the processes, but after recognizing the problem and or the opportunity, the next thing has to be searching for information and knowledge to get to know this particular problem or this particular opportunity better. And with that, you either come up to invent something new or to adapt something. Yeah. With inventing of something new, that could be, for example, the penicillin. It came up to become something new. With adoption, that could be the innovation of mobile applications. Smartphones were present, but then Apple came up and created the Apple Store, and like software engineers can upload their own applications, and mobile applications have changed the world in a very unique way. And then if you invent something or you adapt something, you pilot to find out how it works. This is where implementation research becomes very, very important in the innovation process. And I'm going to go deeper into that later. And then scale. So from my background in Uganda and Africa, scale is one of the things that is ignored by most innovators. There's a lot of things that I have seen throughout the past years that have been innovated, but they have not been taken up to scale. And as we started with our definition of innovation is that you don't just come up with a new idea, you don't just come up with a new product or service. You have to make sure that it is impactful, that it causes change. So until the last phase of scale is complete, then innovation is not complete. Next slide, please. So going a little bit deeper into each of the 6 steps that I have tried to compress the innovation process into. However, I should say there is, next slide, please. However, I should say there is more than 6 steps. I have just tried to compress everything into the 6 steps that I have here. And the first one, which I think is the most important one, is recognition of a specific problem or an opportunity. When I joined my university, I wanted to create something. I said, I want to leave campus when I have created something or I have started to build something. And I started out from the point of wanting to learn how to use the latest technology and the different things. But then I met, I think he's one of the greatest health tech innovators I've met around Africa. And I asked him a lot of questions about how I should structure my steps going forward. And this was one of the biggest takeaways from him. He told me, focus on understanding a problem. Focus on understanding a problem in and out. Because if you know a problem in and out, the answers or the solutions or the innovation will come so easily. And this is the one thing that I hope you take away from here, is that if you want to be an innovator, you have to be so good at identifying problems or opportunities. Most times the opportunities are actually masked in the problems. And that is the one big thing that is at the pinnacle of innovation, the ability to identify problems. And the other thing is searching for existing solutions. And I've just summarized this, but because we are in a world where there is a lot of information, we're in a world that is so connected in that while we have different cultures, the way the zeitgeist is influenced by a certain dominant culture, and things are not so unique in across the globe, even if there are certain cultural uniqueness. The problems are similar in one way or another. For example, when the pandemic hit, the problems were really, really the same. We saw that mental health was a problem almost in every setting, with the rich, with the poor, with the educated and the uneducated. We had almost similar problems. And even as we go forward, we are seeing that these days, the disease demographic is almost becoming uniform, because we're having non-communicable diseases and communicable diseases redistribute across the world evenly. So there is, because we live in an era where there's a lot of information, there's a lot of knowledge, an innovator has to have the zeal to search for the knowledge that is around. And this helps a lot, especially with adopting the existing tools or the existing technology. And the other thing is adapting and the invention. So after recognizing a problem and getting to know it in and out through searching, we either adapt or we invent something new. So no one has the formula to getting a new idea. No one has the specific method, but what is known is that the methods, the new ideas come out of the blue as we work on things. Last year, but one, the Nobel laureates were put on a table, and a medical student in the crowd was given an opportunity to ask them, where did you get the brilliant ideas from? And the Nobel laureate for medicine and physiology said, we allow everyone to put their stupid ideas on the table, and that's how we get them. That's how we get the brilliant ideas. Most of them said the ideas come when they're doing totally unrelated things. And one of them said the ideas come when he does things over and over again. So there is not one thing, but what I should say, I think where the new ideas come from is from our brains being able to make new connections if they get a large amount of information. Because our brains are like algorithms. They process information, then we get output. And how exactly they do that is not very clear. But what we know is that if you work on something for a long time, you become so good at it that you do it differently even without knowing. I play the guitar. And one thing that I realized after playing for some time, I play the electric guitar. And when you're playing the electric guitar, you have to learn these scales. And at first you're learning them note by note. But then you reach a time whereby you're playing with people in a band, and then you play a new set of notes that you never planned to play, and it actually sounds so good. So the thing about getting the new ideas, I would say, is one has to just immerse themselves so deep in the work. And then piloting and scaling. So piloting and scaling work is something that most people from the world of health or medicine, the people I work with the most, ignore, because these involve working with more than your lab, more than the information or the knowledge that you are unique, that you are used to, because it involves going out into the world, which is rough, and probably there's a lot of uncertainty, and there's a lot of politics, there is a lot of economics to deal with. So this is the other thing that I would like to concentrate on, in that as if anyone is interested in innovation, one of the things they have to learn is how to manage a team, how to manage people, and also how to manage resources. Because once you get this new prototype from your adoption or from your invention, you get this prototype, you are going to need to work with a team of people larger than the one you worked with earlier. If you are to complete the innovation cycle with scaling. And while most of the times we focus on the science, I have come to learn that actually the politics sometimes plays a very, very big role. I will share I will share an anecdote from history. When the Dutch people came up with the first microscope, and Galileo heard about it and he got it, and he bought one for himself. The first thing he did was to reach out to the king and told the king about this new instrument and told them that this can be used to see enemy ships just before they come onto the shore. And then the king bought many telescopes and put a lot of money into them because this was benefiting him. And then Galileo could go ahead to observe the sky with all the investment that had been put into the telescope in his country. So the whole thing is that at this stage, when you have something that you think that works, there is a lot that goes beyond you to make it have impact in the real world. And one thing that I would like to emphasize is the politics and the economics around this. We saw during the COVID-19 how much Big Pharma had an influence around the new science of messenger RNA vaccines, and we have seen this now and again, that the people in power influence how far innovations can go depending on how much interest they have in them. And so this is something to consider to garner as a skill for any innovator. In brief, I'll say here is how to manage politics, how to coordinate a team, and the other skills are going to come. And next step, please. So I have, next slide, please. I have hinted on a couple of skills that are required throughout the process of innovation. And I put reading first here because I come from a background where reading is not very much emphasized out of school. Most reading people do is for the exam and or for a test. That is the reading that people do the most. But the primary essence of reading is to understand things better, to understand problems, to understand opportunities. And this kind of reading is not the one where you are getting to remember what the reader said. It is the kind of reading whereby you get to think, oh, what if this is done differently? What if this person is wrong? Or what if what they are saying can be done in this way in my world? And reading is very, very critical for innovators. As I mentioned, there's a lot of things that you need to learn. And there is one sure place that you can always learn anything, and that is a book. So the other critical thinking, this comes really with practice and intentionality, and there's not one way I can say this is how one should learn critical thinking. And then there's collaboration. So because we are talking about this in the context of global health, collaboration is very, very key. If you're innovating around something that goes beyond your border or something that you hope will have impact on the health and lives of people across the world, collaboration is very, very much important. And I personally think the best way to learn how to collaborate with people across different cultures is by diving deep into working with people of different cultures. With this thing, I always encourage people to travel. I encourage people to get to join teams which have people from more than one background, and be open-minded and be respectful, but at the same time also very courageous enough to make sure that you bring out your points of view, because you are very unique. Your background, whether you're from the global north or the global south, your background is so unique that the other people cannot bring out the perspective you have. And the other thing that is really crucial for innovation these days is communication and writing. Recently, a colleague that we work with got an opportunity through social media after them putting up a small excerpt of their article and describing what they are doing. And we all know these days that most of the resources that are gotten for innovation come from grants, and these require you to be very articulate. They require you to be so good with language through writing, and there are a couple of grants that require people to pitch. So you also have to be eloquent enough. And these are skills that are not taught in a particular class, but you have to learn by doing. Research in terms of reading, doing literature review, analyzing data at the piloting process is really, really key for an innovator. And the last two things, project management and entrepreneur mindset, I hinted on this while talking about scaling. So most of the things that end up changing the world are those that are bought by at least, I should say, 1 million people. For someone to say that this has been impactful, around 1 million people have to buy it or have to use it. They don't necessarily have to buy it, but they have to use it. And why this is important is that with every other person that uses your product, service, or your process or your method, there is feedback and there is improvement in that particular thing. And this brings about advancement. And for this to be done, project management and entrepreneurship is very much central. And these are skills that people need if they are to be in the innovation sphere. And the best I'm going to share on how to learn each of these. And if there is a particular skill that you think I have left out and it's very important, you can just share in the chat. So I think I have covered most of what I wanted to cover around innovation, and I'm going to now delve deep into the research side and wrap this up with the intersection. So research is basically a process of inquiry. It is asking questions and observing the world or observing how things are to get a synthesis to answer these questions. It is, most people think about it as the lab work, which is really a part of it. But as I say, most times the biggest thing in research, it is the question, it is the inquiry, it is the gap in knowledge that you identify, and the ability to answer this from analyzing data. So for research to be possible, one has to be good at asking the right questions, at identifying the right data to answer this question and where to get this question and the right methods to answer this question. So with regards to that, I just want to share something from a paper I read recently, I think 2 weeks ago. So if you've been around the health space, or if you've worked as a health worker, you know there's a problem of stress and burnout that has been re-echoed in and out again. And people have done CAP studies, people have done cross-sectional studies to show evidence of burnout, and some health managers have reacted to this by bringing up better working conditions. I read a paper where people decided to investigate the effect of the workload on health workers at the genetic level. It's like, wow, this was a very nice question, because their results actually showed how the magnitude of this problem that is beyond just saying that people feel unhappy. Because it revealed that people are affected to the genetic level in that they get to age faster, in that they get to have higher risk to certain diseases because of the way the workload is structured. So research is really an inquiry into that, into particular things, and identifying the right methods to find the answers and where to get the data. And there are a lot of skills that one needs to do research, but a couple of them intersect with the skills that one needs to do innovation. There's a lot of reading that is required in research, because right now, in this day and age, most research is not the first of its kind. It's really adding on to existing knowledge. So you have to be on top of that particular field if you're to find new answers. Or and as I said earlier, writing is very key, because research is as important as disseminating it, because we know for something to be scientific or something to be respected, I should in quotes, it has to be out there in the scientific world, and you have to be good enough to communicate what you have found, and this is how ideas are improved or adopted, and then they bring up to innovations. Data analysis and project management are still here, critical thinking, and then grant writing. And then the other thing that I want to hint on is resilience. The process of innovation and research, or this time, let me require a lot of resilience, because unlike other things like, let me say, formal employment or working at a particular job where the are straight clear, in research, the output sometimes are not, or the processes sometimes are not as clean. They are sometimes very chaotic. Sometimes there's a lot of failure along the way. Sometimes the answers that come out are not the right ones. Sometimes the grants you apply for, there's like 2% winning. You're winning very few of them. So resilience is very much key. And resilience is key because most times it takes years to get the real thing. It takes years to arrive at the real thing. This year's Nobel laureate who came up with the technique of messenger RNA vaccine shared her story, and she at some point was not getting any money to do her research in messenger RNA, and it's because some people thought it was not that important, but she stuck on it, and it saved the world literally. So resilience is very, very much key. And I'd like to move on to the next one. So now next slide, please. So with the things I have talked about, innovation and research, in terms of identifying problems, identifying opportunities, getting to know them, using the different avenues that are available of research to understand the problems better, to understand the solutions better, to pilot them and understand how they work in the real world. So maybe I would like to mention that one of the greatest opportunities that we have in our day and age is that there is a lot of new ideas that have been put in the world and unfortunately have not been implemented. Like, for example, this year alone, we have seen over 100 plus new artificial intelligence models. But for health, I should say specifically, the new models that are coming out every day. But these have not been put into the healthcare system. And this presents an opportunity for implementation research. And implementation research is really looking at identifying how these new ideas can be incorporated into the routine delivery of health services. And this is, to me, is one of the biggest intersection for innovation and research, in that sometimes the people that are interested in research are not do not have maybe the full set of skills or resources to do the innovation or to complete the innovation process and end up with having products and services come out at scale. And but if we harness these two, if researchers get to look at their work as innovation work, in that it's leading to a product, it's leading to a service, and not just publication of papers or getting to understand their field better, we can have solutions, we can have products, we can have services and new methods of seeing things. And at the same time, if people that are interested in innovation look at it not just as coming up with advanced things through using the technology that is available, but also look at it as something that requires inquiry into the problems, inquiry into how things are done, then we can have the new products, we can have the innovations come up and they are actually needed and they can actually be used. And I think this is the best outcome for both sides. Next slide, please. So with that, I just want to share something small about global health innovation. And this...
I just want to interrupt real quick. You are going into the next speaker's time.
Yeah, this is the last slide, second last slide, I think. Yeah. So the global health innovation really is implementing new ways of doing things, and we saw that it can be things like the vaccine or services like delivering life-saving medications using drones, or policies like the trade-related intellectual property. The trade-related aspects of intellectual property rights. And I put this specifically here because sometimes people don't look at these things as innovations, yet they actually cause a lot of advancement. For example, particularly the TRIPS saved a lot of lives when it came to HIV medication. And sometimes it's just different ways of making, like baby carriers. This particular one in the right is one that is being made in Uganda, and it has magnificent features for premature babies. Next slide, please. So with this, I would just want to say the recommendations for anyone who is interested in building a career or getting into innovation and research is that you have to be curious, you have to ask a lot of questions, and you have to avoid conforming to the system, because unfortunately the system is against change, because the system is made to try to avoid entropy, and we have seen this over time, because lots of people, when they get into the education system or when they get into employment, there's a lot of caging, and you lose the curiosity you had at the start. But I will implore you to avoid conformity and try as much as possible to have an individual curriculum to learn throughout your life, because they have different skills that I have mentioned sometimes, and you may not get a particular degree that will give them to you, but the internet is there and knowledge is open source these days. And collaborate, work with as many people as you can, get to learn from people. And the biggest thing is that you have to just dive deep into it and just start at volunteering on certain teams, or getting to start applying for simple grants or getting to work on things that you can do at zero budget and not expecting so much. So with that, I want to leave with the last slide with the quote from Thomas Edison that says, "There is a way to do it better, find it. There's a way to deliver healthcare better. There's a way to treat people better, and we have to find it." Thank you so much.
Thank you so much, Dr. Mugazni. That was very, very informative. Unfortunately, we're going into the next speaker's time, so I can't open it up for questions at this moment. We'll leave all questions for the end of the conference. There is one message asking how to join AfriHealth in the chat. I would invite you to please respond to that in the chat, please. Dr. Akwawo, are you ready to start sharing your screen?
Yes, but I don't know why this is saying update. I'm ready though.
Your screen is updating?
Okay. Yes. Okay, it's connecting now. I think you'll see the second. Oh. Okay. It's updating.
Oh, I don't have a copy of your slides. I never got them, so I can't do it. I can't upload them for you.
Okay, I'm here now.
Dr. Mugazni, while we have a moment,
Okay.
I want you to add in the chat one more time how to join AfriHealth. That is one question that came from your talk.
Yeah, thank you again, Dr. Mungazi. So while we're waiting for Dr. Kawa's screen to come up, there's another question in the chat from Amy Chris. So they're asking, can we have volunteering groups, available grants where interested persons can link up easily? So I guess that would still relate back to AfriHealth. Like that's one opportunity for collaborating for health through AfriHealth, and of course through CUGH, the CUGH website. There's lots of links to groups to join, and their grants also that the CUGH gives out as well. I hope that answered your question, Amy Chris.
Okay, I'm sending my slides to you just in case, because I'm not sure why I can't share now. Okay. Okay, here we go. Thank you. Can you see my screen?
Yes, we can see it now.
Okay.
Can you put it in presenter mode, please?
Yes. Okay. I don't know if it's still morning. Good morning, good afternoon, everybody. Thank you very much for the opportunity to present on this topic, decolonizing global health. I chose to focus on research partnerships of the future. And okay. Sorry, can I just go on? Have I been introduced to go on?
Please continue, Dr. Akwawo. Go ahead and
Okay.
introduce yourself real quick and continue.
Okay, so I am a physician by training. I'm a medical doctor, but I have worked in the field of public health for over 20 years. And I have largely worked here in Nigeria, the Niger Delta region. But my teaching and research goes across countries because I have been able to work with some partners across continents. And so I guess that's why I was chosen to deliver on this topic, decolonizing global health research partnerships of the future. So I'm using this outline, the decolonization movement and current situation of research partnerships and the challenges and the future. So decolonization is a buzzword that has been on for years. And I see it as a movement, because both the people who feel they need to be decolonized and the people who are trying to decolonize are working towards the same goal. And I loved there have been many definitions of decolonization, but the one that sticks for me is the one that Merriam-Webster dictionary puts up. It says it is to free from the dominating influence of a colonizing power, especially to identify, to challenge, and revise or replace assumptions, ideas, values, and practices that reflect a colonizer's dominating influence, and especially a Eurocentric dominating influence. So based on this definition, it tells me that sometimes the idea of colonization may not have been deliberate, especially when it comes to research. Certain factors over the years have made it come to stay. And so the realization that things need to change, things need to be done differently, for me, is what stands out. And one of the authors says that the aims of decolonizing global health practices actually is to achieve equitable collaborations and center projects around local priorities, diversify leadership, while at the same time promoting respectful collaborative interactions and language and tone in all communications. Unpacking what these 4 points mean actually involves a whole lot. And we see the aims of decolonizing global health practices, but not just taking only one aspect. It is taking everything at the same time. And for me, underpinning all of this is the fact that the original concept of decolonization connotes freedom. It's freedom all round, economic freedom, psychological, and social freedom. The freedom to be and exist in your context and thrive in that context. So the concept of decolonizing global health stems from inequities in power relationships. Now, we say global north and global south. So the high income countries seem to have an advantage of for so many reasons. And the lower income countries are disadvantaged. Addressing these inequities actually is at the heart of decolonization. So the decolonization experience for me, I first came in touch with decolonization when my teacher, Nigel Crisp, in the London School of Hygiene and Tropical Medicine, we had, during my MSc year, when I did my master's, we had a meeting, and he came around, and that was when this book was launched. And it said, Turning the World Upside Down, the Search for Global Health in the 21st Century. That was sometime in 2012, I think. And for me, this was key. I personally read through the book and found it very intriguing, showing that low middle income countries possess different insights based on their lived experiences, which I totally agreed with him, that they can innovate and solve their problems, which can be translated to high income countries. Majority of their innovations are free from vested interest, and there is a lot to learn. So with that, it says that he argued that affluent and powerful countries in the world should pay attention to the low middle income countries. So for me, this set me thinking at that point in time, because I went to London with the idea that, yes, I was going to learn, but I was so sure I had a lot, from my context that I wanted to give out. That was why this really resonated with me. And so the idea of thinking local and acting global was, reversed for me. So I now had to look at both sides of the coin. I was already used to thinking global and acting locally. So this was like, okay, now you are actually free to think global and act locally. And so if you key in decolonizing global health, within 0.30 seconds, you're going to have about 2.3 million results, because it's been an ongoing and very captivating debate. So many people have written, so many things have been, so many ideas have been discussed, from decolonizing TB, decolonizing everything, decolonizing education, everything you can practically think of. And these are some images you would see if you just Google. You'll see so much has been discussed on decolonization of global health. Okay? So what are the challenges? The current situation is that the 90-10 gap exists. Now, this 90-10 gap just says that only 10% of global health research is devoted to conditions accounting for 90% of the global disease burden. So funding is allocated in a very imbalanced way. Only 10% of funding is allocated to where 90% of the world's population lives, and where the disease, 90% of the global disease burden can actually be found. This has not changed much, and it is a big problem. And because of this, you also see that research is also skewed towards the developed countries, the high income countries, because a lot of the researchers are able to fund and put out their research there. But the researchers in the low middle income countries have work, some have done work, but it's not visible because they cannot put up their work in the, high impact journals, right? Where the cost is totally prohibitive. And I found this journal, the Commission, Lancet Commission on Global Health 2035 report, a world converging within a generation. The interesting thing is that they talked about this 90-10 gap and posited, different ways, telling us that, yes, it can actually change. But despite all the, the discourse on decolonization, the status quo remains. So for example, in Nigeria, the issue of capital flight and the brain drain. So there's a lot of, and it's in our local parlance, you will hear people say he has jackpot. Jackpot just means the person has left, often with no intention of returning. And that's because of in search of greener pastures, right? And so the person leaves without the goal of returning. And this spreads across all sectors of the economy. So in the banking sector, in the health sector, education, there is a capital flight. Then we also have proxies of colonialism. For example, some research dissertations in low-middle income countries still reflect high-income countries' agenda. Some largely because some of the people who are supervising have brought their own agenda and say, this is what you need to do. And then if a supervisor says that is what you need to do, of course, that is what the student is going to do. There's also inability to tap intellectual remittances from the diaspora. As I said earlier, some people leave totally, they have no intent of coming back. So kind of, if you don't deliberately reach out to them, you're not going to get that, feedback. You're not going to get anything back from them, okay? So it's like a loss to the home country. Then some institutional cultures and policies are unfavorable. We find out that in some of our universities, the policy is not favorable to writing, especially in teamwork. So the promotion policies for some universities is that you write or you perish. That is what we say, write or perish. But the writing culture is entrenched with things like you need to write alone, and so people try to hide their ideas, or it rewards single authorship, or it rewards you if and only if you're the first author. Those are all things that, are quite not very favorable when it comes to research partnerships. And then there's continued power asymmetry. Most times, because the person in the high income country has access to the funding, it definitely sets the agenda. Then there are other factors. For example, I want to work in a research team and your time is not favorable with mine, the time zone difference. And we have to work on, the internet platform. I mean, the COVID pandemic actually taught us that we can do a lot on the internet platforms. But prior to the COVID pandemic, the communication platforms was a problem. And I remember very well trying to work with my research collaborators in Canada. And I had to be waking up by 1 a.m. in the morning to join the research meeting 1 to 3. So that was a big problem, but I persisted. I'm happy, and we got through to achieving our goals. And sometimes there's conflicting guidance. You're working in the low middle income country, your university, and then you're trying to work with another, especially if you are a doctoral student, and then you have 2 supervisors. You could have 2 conflicting policies. Based on the policies from the 2 different universities, you have conflicting guidance on your work, and this could be a big challenge. So I'll just at this point share my experience engaging with actually Professor Faith Michael Uzoka. He works with the Montreal University of Canada. How did I get to meet Prof? We were trying to respond to a call for developing a center of excellence. I think it was shared by the World Bank. And we tried to apply in my university. I was the health person on board. And we did send out the call, but we didn't succeed. I mean, it wasn't, we didn't win the grant. However, we developed a mutual bond of research collaboration, and that was, must have been like 2015, the year 2015. So over time, by 2018, we worked together to co-develop a proposal to respond to a new Frontiers in Research Fund of Canada call. And that's led us to, we won the call because we started from what do we do to address a challenge in our environment. And we worked together on the call. We developed a proposal that won the grant to develop an app to respond to febrile, to help healthcare workers, the middle cadre healthcare workers in low resource settings to respond or to manage febrile illnesses, to make diagnosis of febrile illnesses. It was a whole lot of work, a 4-year engagement. We started with the systematic reviews, and then when we finished, we co-developed the tools together that we needed to work, to do the work. After developing the tools, we tested, we did the field testing, and then we now went into the field and gathered the data, and then eventually we analyzed, and then we developed the app. Right now, the app is at the stage of being piloted, and we are actually trying to scale up. We are looking for scale-up grants, right, to continue the work. But that relationship remains, and it's ongoing. So personally, lessons from my experience include that research partnerships are an excellent way to build capacity. It was key to identify mentors and mentees. So Prof was able to identify mentees identify us as mentees, postdoctoral researchers, doctoral students, PhD students. And the other thing is that it requires commitment. There's need to invest a lot of time and resources. Partnerships would not work if you don't give vested time. More like if you don't have this secure time to do the work, it becomes a big challenge. So, and remember that at the same time, the work that you need to do back in your setting remains. It may even be a very different thing from what you are, engaging with your research collaborator. So there's need to invest time and resources. In our case, we had to do Friday evening meetings, online meetings from like 7 to 9 for almost 3 years. And by the time we were analyzing the results and building the app, building the model, we ended up spending almost every day, almost every evening was engaged in the work for more than 6 months. And there's need to build relationships with policymakers to ensure success. So from the inception, I had to go into the policymakers at the subnational level. I connected with them, including my vice chancellor, my state commissioner for health, and the people in charge of primary health care. And so they were able to support what we were doing from the beginning. Then mutual respect and willingness to support each other. As I speak, Professor Uzoka would always call me in to, ask, how are you doing? And I'm happy that we've been able to support each other for conferences. We work together and also until I got my recent promotion to my associate professorship. And so it has been a huge support for me. Willingness to develop and mentor others is crucial. And so while Prof was busy mentoring me, I was also busy mentoring other people whom I can say are doing very well too from the relationship we built. So what would be mutually beneficial partnerships? I think the first thing is an agenda setting. Collaboration and networking are key elements for optimal success of research and development initiatives. So agenda setting is key. If you invite us to set the agenda together, partner from inception. And then one thing I want to really point out is that, yes, when calls for RFPs are sent out, requests for partnerships are sent out, they have a rather impersonal look, right? If you feel you have identified, now I'm saying this from my perspective as a researcher that has worked in the low middle income countries. If the people that are setting the agenda because when the calls come that way, they might be impersonal, the person may not also be focused, and the person may not be sure of his or her strengths. So it's important that sometimes you could actually reach out and request a collaboration. And RFPs should be generated with the input of the people at the whom you are actually targeting. I think it makes a difference because it makes for better understanding. So co-creating memorandum of understanding and request for proposal will allow for ownership, allow for better understanding, and helps to ensure that program delivery does not benefit one institution at the expense of the other. So I will say what I mean here. So most times, the time that we need to carry out research and engage in research collaborations are actually time that is also needed by our home university to teach and also carry out maybe administrative tasks. So if we can, create an MOU that would actually make room for that time, I think it will also help. And then the next point is that we need to empower universities to be economic drivers and agents of knowledge transfer. The way to do this is to build research capacity. Granted, yes, we would say that before anybody engages in research, the person should be should have the capacity. But the truth is that a lot of people in the low middle income countries do not have access to the trainings opportunities that they would love to. So it is important that we build research capacity and then strengthen institutional policies. I have given an example here. Some African universities have been used to provide a market for their partners in the global north. Because these universities are credible platforms, people are going to come in and do short courses, and then money is paid on the platform. Collect fees for the foreign partners. It is important to build research capacity at that level. It shouldn't end with the programs. For me, I have experienced, attending short courses, and then you try to re-establish contact with the people whom you attended the same course with in the high-income countries, and they don't just answer you. I think that is one key aspect that needs to change. When a short course or anything is organized, please build institutional capacity and how would I put it now? Engage the person that also had that training with you, so that we can have mutually beneficial research partnerships, and build the knowledge economy by structuring research partnerships to work, making it efficient and sustainable so that it will generate research and teaching capacity. One of the key things that I think needs to be done is to conduct needs assessments and identify policies within the two institutions that are positive for the research collaboration, and some could be negative or at least a hindrance, and identify things that must change. When that is done, I think it allows for the partnership to work well. And explore the possibility of improving the knowledge base. We're not saying that you're forcefully going to change the narratives in either ways, no, but we could improve the knowledge base and actually improve the policies by the time you're done with your research. For example, partnerships between well-established universities in digital learning with less established universities should aim at developing those less established universities. Okay? The metrics for measuring success, this is what is used generally to measure success: number and amount of research grants won by the research team, number of collaborative projects implemented, number of exchanges that took place across the institutions, number of graduate students supervised that successfully completed their programs within a certain period, and the number of jointly published research papers. I think these are good metrics for measuring success, and also the number of patents registered. They remain very good metrics for measuring success for me. Now, factors critical to the success of research partnerships include funding, communication, synergy, and what I've written here. For funding, I think I've said something about it much later too. But the key thing is timely release of the funds, and also transparent administration of the funds. Sometimes we find out that the funding gets released, but it does not get to the university or the researcher. It becomes extremely difficult to carry out the research. So it is important that research collaborators, especially those working in the low middle income countries, should ensure that institutional policies are followed in such a way that you're able to access your funding. And if you cannot, you need to get, the information needs to get to your funders. that, okay, this money had been released, but it hadn't come to me. I personally had those issues, and it took time, it dragged before I was able to get the money. And then communication, very important. Regular communication with the on the team, with the team members, monthly, quarterly, depending on how often you want to hold meetings. Those are very important. And I found also that social media platforms were very useful as it kept us, communicating over time. Then synergy in the projects that we are doing, very important. And it was crucial to disseminate findings. So we would always have, we had published papers in peer-reviewed journals. We held meetings. We held workshops where we were able to disseminate the findings of our work. And organizational compatibility, very important. Simplicity of the project too, and the way what we're doing is related to the people whom we are reporting to is also key. And evaluating our measurable outcomes is also important. Sorry?
I just want to show that there's only about 3 minutes left. I don't know if this will.
Okay, all right, I'm almost done. Then there's respect for the community. And by the community, we include not just the community outside the university, so the indigenous academic community, the health and development organizations, and we need to encourage positive, wholesome cultural practices. And there's need to honor the MOUs and institutional policies and frameworks that have been put in place. And data sets and funds management too is key. We need to recognize institutional and governance policies, transparency, ensure transparency in funds management, and freedom to integrate culture and context in budget. So for example, in my culture, you cannot go into a community without meeting the gatekeepers. And the gatekeepers are the people whom you cannot go to without a bottle of gin. It's a mark of respect. So those things need to be integrated into your budget. And finally, there's need to build long-term commitments. We don't want to just finish the project and that is it. We aim to create collaborative research writing teams where from the conceptualization, you have these people producing drafts with direct support, brainstorm, develop the outline, provide opportunities for discussion, motivation, and feedback, and joint authorship and co-authorship in peer-reviewed journals. I think I have come to the end since the end of at the time. Thank you very much.
Thank you so much, Dr. Akwawo. Now, I do understand that we're at 12 o'clock. We don't really have much time for questions and discussion as originally planned. We had a couple of hiccups when changing speakers. I don't know if you and Dr. Mugazi want to put their emails in the chat so people could reach out to you directly with any additional questions.
Okay. Okay, thank you. I'll do just that.